The head of a leading hospital at the center of the coronavirus outbreak dies as the virus continues its rampant spread throughout China. A new media report in China revealing more detail of China's cover-up. Local doctors knew the virus to be contagious long before the official report. A medical professional in Wuhan tells us many of her colleagues are infected and she herself has prepared for the worst. 150 million Chinese are now under so-called lockdown measures as the communist regime tries to stem the coronavirus outbreak. And aboard the Diamond Princess cruise ship, 88 more confirmed cases, raising the total number of infected to 542.
Welcome to China in Focus. I'm your host, Tiffany Meyer. While the Chinese communist regime continues to say everything is under control amid the coronavirus outbreak, the situation continues to worsen. The head of a leading hospital in Wuhan died of the coronavirus on Tuesday. Liu Zhiming was the director of Wuchang Hospital, which is designated for treating virus-infected patients. This is the first case of a head of a hospital dying from the coronavirus, but not the first of medical staff. 3 days ago, a nurse from the same hospital died of the coronavirus. Her parents and brother are also infected. According to state media reports, there are over 3,000 frontline medics infected in the whole of China right now. But according to Epoch Times interviews with hospital staff in Wuhan 1 week ago, they calculated there's an infection rate of 3.3% among medical staff. That would put the infected health workers at over 6,000 in Hubei province alone. The situation now, 1 week later, is supposed to be even worse. A video of an interview in China's state-controlled media has gone viral. Head nurse of Tongji Hospital, one of the biggest hospitals in Wuhan, said nurses had to collect several 100,000 samples from patients. She choked from emotion while speaking.
为什么您说到这儿会掉泪？
几十万呐，几十万的标本要采集，每一个标本都是护士面对被感染的这样一个风险。
Another video posted yesterday shows a nurse falling to the ground. It is not clear if it was because of excessive fatigue or becoming infected with the virus. There are mainly two reasons for the infections of hospital staff. In China, there were reports from hospitals in Wuhan of human-to-human transmission cases as early as the end of December last year. But it wasn't until January 20th that it was announced that there is human-to-human transmission. Before this date, most of the hospital staff worked with patients without protective gear like hazmat suits. After that date, there has been a serious shortage of protective gear. A hazmat suit should be destroyed after using it once, but staff from many hospitals said one piece of hazmat suit is worn many times in the hospitals, and sometimes it's disinfected with alcohol. It increases the risk for the medical staff and also the chance of cross-infection among patients. In efforts to stem the coronavirus outbreak, at least 80 cities are in so-called lockdowns. 150 million people in China are facing restrictions in leaving their homes due to the coronavirus outbreak. That's over 10% of China's population, including Beijing and Shanghai. In some cities, citizens only need to show their ID and have their body temperature measured when they enter their communities. While in some other cities, only one person per household is allowed to go out every 2 days for 1 hour to buy necessary things. So what does it look like under a lockdown?
看吧，把它封的，每家都是这样的，你全部都是这样封的，看吧。 你我是哪一家了？你我是哪一家了？切嘛封的，看嘛，你家家户户都跟封了。
This video shows empty streets. Every door is barricaded. Not a soul can be seen, except for the sound of the cameraman's exasperation. Residents are increasingly upset with the Chinese Communist regime's way of handling the coronavirus outbreak. In a viral video, a lady in Wuhan condemns the Chinese Communist regime. She calls for people to free themselves from the evil hands of the Communist Party, corrupt regimes, and evil societies. She says no one can speak freely, and anyone who tries to will be detained and sentenced. Authorities decide how long someone will be sentenced. She adds that lawyers are useless because righteous lawyers are themselves locked up. She says she's speaking up for her parents and so that later generations can live freely, adding that her family, such as her parents, are waiting at home to die as the regime does not care about the lives of the people. In another also viral video, a young woman says the biggest problem is not the current epidemic, but the mental epidemic that has spread for decades. One mobile medical waste incinerator has been sent to Wuhan to help amid the epidemic. It can process 5 tons of medical waste a day. That's according to the Nanjing Luzhou Environmental Protection Co. under the China State Shipbuilding Corporation. In the next 2 weeks, nearly 20 more medical waste incinerators will be sent to areas with severe outbreaks, such as Wuhan. The death of a whistleblower doctor in Wuhan shows the world China's cover-up of the coronavirus outbreak. However, details revealed by a recent news report in China discloses there's more. The cover-up may be more systematic and deep-rooted in China's political structure than people think, endangering the whole world.
Dr. Li Wenliang is not the only whistleblower, nor is his important warning the only one silenced in China's coronavirus outbreak. A new report by Chinese media outlet China Newsweek shows that doctors in Wuhan tried to alert people that the virus is contagious as early as December, but their voices were suppressed. This is a lab result of a patient admitted in Wuhan's Central Hospital on December 27th. The red circle shows text that reads SARS coronavirus as the pathogen. The director of the hospital's emergency department, Ai Fen, said that she was terrified when she saw this diagnosis. She said she immediately reported it to management, but never heard back. On January 2nd, Ai Fen was requested to have a talk with her manager. Management criticized her for having no professional principles and rumor-mongering, and that such irresponsible behavior has created panic in society. Since that day, the hospital's management made 3 requirements. All staff cannot openly discuss the outbreak, nor can they discuss the disease through text, pictures, or anything that can be saved as evidence, let alone disclose anything to the patients. Ai Fen said that since January 1st, the hospital has seen a surge of fever patients like a volcanic eruption. The second week of January, the overflow of patients pushed the hospital to convert other department space to observation rooms. Still, there is not enough space for all the patients. On January 10th, a nurse working in the hospital's emergency room was infected with the virus. A research paper later showed that from January 1st to 11th, at least 7 healthcare providers were infected. Chinese authorities did not admit there is human-to-human transmission until January 20th, leaving a long time that put China's healthcare workers at risk. Reporting by Penny Zhou, NTD News.
Also in Wuhan, a medical professional told NTD that many of her colleagues are infected. She herself has prepared for the worst.
It's getting harder to hear from people at ground zero of China's coronavirus outbreak. 5 more doctors were detained by Chinese police for publishing footage of the epidemic filmed inside their hospitals. But this Thursday, NTD was able to speak with a medical staff member in Wuhan over the phone. She works in a hospital at the epicenter of the outbreak. To protect her identity, NTD did not use her original voice and refers to her with the pseudonym Qin Qin. Qin Qin described the desperate situation inside the hospital.
It's more than just hard. For a while, we didn't have any food. The places that provide food were shut down. Now the meals we have are all donations from the society. If it were not for the donation from society, our hospitals would be over long ago.
Qin Qin is in charge of the hospital's medical supplies. She said due to the lack of supplies, only doctors and nurses who are in direct contact with patients can get the right protective suits. Those who don't only rely on face masks and rubber gloves, which are quickly running out, putting the lives of the medical staff on the line.
60 to 70 of my colleagues are infected. Some are being treated, but no one is certain. Yesterday, one of my colleagues, he's a guy in his 30s, he just collapsed while working. Later, we found out that he was infected.
She hasn't taken a single day off since mid-January and has now prepared for the worst.
Because of the outbreak, I told my lawyer to prepare my will. If something happens to me, I need to know who is to take care of my child, what will happen to my parent, and what would be done about the house. I think about these problems every day. I don't know what to do. If you ask me whether I am scared, to be honest, I never thought about it, because I don't know when I will be gone.
China has been tightening up censorship around the outbreak. A court from one Chinese province recently said that spreading rumors about the coronavirus can lead up to 15 years in prison. Reporting by Xiaohua Gu, NTD News.
Over 300 Americans who were on the cruise ship off the coast of Japan have been brought back to the U.S. after 2 weeks of quarantine. Some tested positive for the coronavirus but were able to board the planes anyway. They are now at the University of Nebraska's medical center being treated.
The U.S. is bringing back American passengers from the cruise ship Diamond Princess. On board is the largest cluster of coronavirus cases outside of China. The University of Nebraska's medical center on Monday taking in 13 high-risk patients. They have or likely have the coronavirus after traveling on the cruise liner that is now docked in Yokohama, Japan. The medical center previously handled Ebola and SARS. One American passenger who is confirmed to have the virus is in isolation at a Tokyo hospital.
I've never really felt so alone. I haven't actually had physical contact with anybody outside of somebody, taking my blood pressure or checking my lungs with a stethoscope in 12 days.
Another passenger, who's now at the Nebraska Center, has been sent to the biocontainment unit for further evaluation. The hospital says the patient is stable and doing well. The other 12 patients will be placed in federal quarantine for 2 weeks. Despite U.S. officials saying no virus patients would be repatriated, 14 sick passengers were still allowed to board the U.S.-bound planes after they were found to be infected at the last minute. The new patients arrive as 57 U.S. evacuees remain under quarantine at a Nebraska National Guard training base just southwest of Omaha. Japan currently has 74 confirmed cases of the virus, while the Diamond Princess has 542.
The Diamond Princess cruise ship, docked in Japanese waters, ends its coronavirus quarantine tomorrow. Governments are planning the evacuations. Meanwhile, Japan says it may be able to treat the coronavirus with HIV medication.
Japan plans to trial HIV medications to treat patients infected with coronavirus as the number of cases in the country keep on growing. 88 more people aboard the Diamond Princess cruise ship in Japan have tested positive. The ship is near the end of its 2-week quarantine. Those aboard can begin to disembark Wednesday as long as they test negative for the virus. Those testing positive will go to the hospital. Some 3,700 passengers and crew remain in confinement on the Diamond Princess. So far, there are over 600 confirmed cases of coronavirus in Japan, with 540 of them from the ship. Japan's government said clinical trials using HIV medication on the virus can start as soon as possible. He would not say how long it could take. Canada, Australia, Italy, and South Korea are now also planning evacuations for their citizens on the cruise liner. A South Korean presidential jet departed on Tuesday to pick up 5 of its citizens. 14 South Koreans were aboard the Diamond Princess, passengers and crew. None tested positive for the virus. Australia's Prime Minister Scott Morrison announced it will evacuate more than 200 of its citizens from Japan on Wednesday. Those returning will have 14 more days in quarantine in Darwin.
It's frustrating and it's unfortunate, but it is absolutely necessary to ensure that we put the measures in place that have been so effective in containing the spread of this virus and ensuring that Australians here can go about their lives on.
He said they would also bring back New Zealand passengers who would be transferred on from Darwin. Britain and Taiwan are also planning evacuations for their citizens, but details are not yet decided. Both have passengers infected with the virus.
Hong Kong has suffered a triple blow amid the trade war, social unrest, and the virus outbreak's impact, an economist said on Tuesday, which could be the beginning of the end of its position as an international financial center.
It's the beginning of the end for Hong Kong as an international finance centre. That's the dire message from one economist in this embattled city on Tuesday. Francis Lun says the latest coronavirus outbreak will deal the knockout blow to an already battered economy.
Last year we suffered from the trade war and then the civil unrest. And now when we are just about to get back to our feet, and we had the coronavirus outbreak, so it's a triple blow. I don't think Hong Kong will ever regain its former glory. This is the beginning of the end.
Flights and hotel bookings have been cancelled, driven by both travel restrictions and fear. A handful of big events like the Rugby Sevens in Hong Kong have also been postponed, events that usually draw in big crowds and big dollar signs. The city is also grappling with a tough labour market. New government figures released on Tuesday show unemployment is at its highest in 3 years, rising to 3.4% in the 3-month period to January. Hong Kong's leader, Carrie Lam, who's no stranger to a crisis, increased a relief fund to tackle the impact of the virus. She announced on Tuesday government handouts to businesses and the hospital authority will increase from $3.2 billion to $3.6 billion. Other recent measures, though, haven't been enough to combat anti-government protests, which have continued across the city.
Here at China in Focus, we bring you first-hand information from inside China. Don't forget to subscribe for the latest updates.